for a while. And of course, in primary care, we're very used to being the folks who are providing these vaccinations.
Hello, I'm Faith Rogers, host of today's program, COVID-19, Keeping Up with a Moving Target. This is the December 11th update of DKB Med Radio's Coronavirus Educational Series. Thank you for joining us. This activity is jointly provided by the Postgraduate Institute for Medicine, DKB Med, and the Institute for Johns Hopkins Nursing. Today's program is accredited for ANCC and AAPA credit, as well as AMA PRA Category 1 credits. Please visit our website for complete CE information. If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. There you will also find all of our previous COVID-19 programs and have access to other free CE programs on a wide range of topics. Today's learning objectives are describe strategies to counter vaccine hesitancy and discuss currently available safety data pertaining to the messenger RNA vaccine that recently received emergency use authorization. With us today, we have Dr. Paul Auwaerter, Clinical Director of the Division of Infectious Diseases at Johns Hopkins School of Medicine. He will be interviewing Dr. Chuck Vega from UC Irvine School of Medicine. Dr. Auwaerter, Dr. Vega, thank you for your times.
Well, thank you, Faith, and I am just delighted that Dr. Vega has joined us. He has great expertise in primary care and also respiratory diseases, and we have perhaps one of the most significant ones in the last 100 years with the coronavirus. But today, on December 10th of 2020, we're on the cusp of the Food and Drug Administration likely granting emergency use authorization for at least the first COVID-19 vaccine in the United States, and that's the BioNTech Pfizer collaboration with a vaccine that's a messenger RNA vaccine, which of course has already had approval in several countries, namely the United Kingdom and Canada. So Chuck, what's your sense just among physicians first? Let's just talk about your colleagues and so on. There's been enough in the news, not only press, but of course scientific papers about these vaccines, and it looks awfully good so far. Efficacy is outstanding and little in the way of serious side effects. Lots of local reactions, but what's, before we get into our patients and so on, what's your sense amongst your colleagues and even some of your staff, for example? What do you think the messages are there at this stage? Because this has been hard because information comes out here and there.
Here and there and everywhere, and sometimes it's quite contradictory, as you know, depending on your sources. But I think overall, the mood is very hopeful. I mean, how can you be anything but hopeful at this stage when we've had therapeutics that really haven't, made in a major way move the needle with stemming the morbidity and mortality of COVID-19. We've been looking to vaccines for a while, and of course, in primary care, we're very used to being the folks who are providing these vaccinations. So. That is pretty exciting, and you're right. The efficacy studies so far have looked very good for the messenger RNA vaccines, both the Pfizer BioNTech vaccine and the Moderna vaccine. So there's a lot of encouragement there, but we also have to think about other priorities, which are patient safety and tolerability, and then also more than ever, I think, logistics and how, what role will play in primary care, how will these vaccines be distributed and ultimately given to the people who need them most. And that's part of what the hearing is about today, I'm sure. This news is evolving in real time, which makes us, it's a challenging time, honestly, to be keeping up, but it's also so critically important when we think about the global pandemic and the devastating toll it's had across the planet.
So, we obviously don't yet have a Food and Drug Administration EUA for the vaccine. We already have seen plans that are very state dependent. You have California, for example, on distribution. What have you heard so far just from your patients? Do they feel like the current allocations seem fair? Do people that perhaps really want the vaccine but realize that they're a little further behind the line? What's your sense this stage on the sort of fairness angle?
I was worried about that, and I think that people should question how the rules are made and who is making these rules, and I certainly hope that they are being made with not just the experts who are the experts in the science behind vaccinations, but the experts who look at public health as well and epidemiology, and can really design a program where the vaccine has its greatest impact overall. But my patients aren't really focused on that. I've been surprised as I've had more conversations, especially over the last few weeks with patients on this very subject. Boy, I see a lot more vaccine hesitancy and resistance than I thought, and I think there's going to be based on my limited example in Santa Ana, California, mostly older adults with a lot of chronic illnesses. I think that there's going to be a lot more complacency about getting vaccinated than I was expecting.
With vaccines, we have two sides of the coin, right? We have efficacy, and then we have adverse reactions. As we said, the efficacy has just been quite impressive, at least in the short term here. Even after the first injection of the Pfizer vaccine, it looks by maybe day 10 already that protection is garnered at this point. That's really maintained with the second immunization 3 weeks later. What's the one or two messages that you think you'll try to use to explain, based on your knowledge so far and what we saw in the briefing document perhaps just yesterday, about this particular product to your patients, in terms of trying to convince them that this works?
Well, I think that we haven't seen major safety signals, and these are trials that have involved thousands of people. I think that they're going to be highly scrutinized once they are. I assume that they are going to be allowed for emergency use, and so once they're administered, I think they will be scrutinized for serious adverse events. And so I'm reassuring patients, that they won't be in that first tier to get the vaccine. That actually it will be, healthcare professionals will likely be in that tier who have some experience, and they know, we've all had lots of vaccinations, right? We know what to expect from vaccines, and we know that when there's something that's off. I would also warn patients, and one thing that I'm a little bit concerned with, in terms of the broader application is the systemic side effects you mentioned. So while so far we don't see major safety signals from the vaccine, we can expect some pretty significant, short-term reactions. With the reports that I've seen, over 50% are having maybe some myalgias, and some maybe a low-grade fever, and that's going to last a day or two, and it's more of a nuisance. And it's not that incredibly dissimilar from maybe other vaccines, but it's a higher rate. And during a pandemic, especially when everybody's concerned about could this vaccine, of course, give me COVID-19. That's always a tremendous concern on the part of the public. We're gonna have to do a lot of education and reassurance of folks that if you develop those symptoms, they're probably going to be mild in that first 1 or 2 days, and as long as they're mild, resolve, I would probably recommend antipyretics, analgesics. I would love to hear your opinion on that, Paul. And then it's not COVID-19, and this is something normal, and you can go ahead and receive your second dose safely.
Yeah, I think you're making very good points. I mean, local reactions are really very high. Everything is much worse, as you might expect, with the second dose. There can be fatigue, headaches, myalgia, even fever in 5%. And interestingly, younger people tend to have more side effects than older people. Now, those of us over 50 have gotten the shingles vaccine, the new one that also has an immune adjuvant in it. I'm sure you have some experience with your patients as well. I've had a number of patients who really just don't want to get the second shot, and I have a feeling this is like Shingrix on steroids. This is going to be worse, but the health benefits of it personally and even from public health are far greater. I mean, I find that convincing people to take the shot for community good probably isn't going to carry the day. So most people
No.
are wondering what's going to happen to them. So, yeah, I think you make good points. But how have you handled people that were very reluctant to get the second adjuvant zoster vaccine? Because
Right.
we really don't want to twist arms. Typically, I don't for people to do anything.
Right. Yeah, of course we want to be in alliance with our patients and moving forward together. That's always the much more comfortable space for us as healthcare professionals. But it does take, I think, an iterative process and just talking through it. And with the rate of those systemic side effects with the zoster vaccine, it's about 20% of people. So it's definitely worth the conversation. But while I write the prescription, what to watch for, and it is kind of that ounce of prevention is worth a pound of cure. Thinking about how miserable folks are with shingles, how their quality of life is going to be substantially reduced at least for a couple weeks while they have the active lesions, and then 10% go on to develop post-traumatic neuralgia. It can last for months or even years, and there's a vaccine that can take away that possibility to a degree of over 90%. That's remarkable, and that's exactly why. So I do return to the data, but I also tell my patients, I make it very personal. I think that the key is, and especially with this first wave of healthcare professionals, we have the ability now where we can make it personal. We can tell folks, hey, I did get this vaccine. Here was my experience with it. But I also recommend it to my kids and my parents and the people I care about, because it's a life and death issue. This is a clear one. Sometimes I feel like I have to sell vaccines. The influenza vaccine in particular, there's a lot of misbeliefs about that. This one, it's been everywhere, literally, and in the media for months and months. And so, boy, if we can't get this one over, then that's just a tough statement. I just can't believe that we won't be able to vaccinate the vast majority of folks, but it will take a coordinated effort that comes down to the individual healthcare professional, one-on-one with their patients.
Yeah, I really hope so as well. So much of this pandemic has had certain aspects politicized, unfortunately, which I think have been to the contrary of the efforts, both physicians, public health authorities, and so on. I think it's great that 3 former presidents have all said that they're going to be immunized. And I think what I have told patients who have asked me, knowing that they're not getting the vaccine immediately, is that the vaccine is going to be a liberating experience. And it's not
Right.
only liberating because so far it looks like it's been entirely protective for serious infections, right? You won't need to
Right.
go to the hospital. You won't end up in the ICU or die, it seems, for the most part. And also, it's liberating for younger people. You don't have to be fearful that you might carry the virus when you're seeing grandma, or you can go and see grandma, or other people that might be at high risk. And so, I think these are those kind of personal messages to try to figure out what would motivate someone to get the vaccine. And I think the side effect profiles, at least with these first 2, are going to be considerable, but yet the efficacy of it, it's really astounding, I think. And we're all, I think many of us in the infectious disease world are very extraordinarily pleased to see how well this performs.
Right, and you're absolutely right, and I think that will be a motivator for some folks. But it's always balanced, right? We have to think of the whole picture in healthcare, and so I'm a little bit afraid of providing too much reassurance, and so people think, well, I got vaccinated, my 2 doses are on board, so I can go back to my normal life, and we don't know what things are going to look like 4 months from now, 10 months from now. And certainly, I'm sure we're still going to need some of those public health measures, such as distancing and mask wearing. That's not going away. But Oh boy, to see families struggle where we have these, particularly seniors in my practice, is really prominent who are isolated. It just breaks my heart, and it breaks my heart personally, for my own family as well, because I know what my patients are going through because we are going through the same process, and if we can do anything to short circuit that, and I think that will have huge impact on folks' mental health. It will get patients healthier again because they'll be able to feel comfortable about going outside, and all those things lead to much better health outcomes in the aggregate beyond COVID-19.
Yeah, and I think it's those kind of amplifying issues that if you get even the economy speeding ahead, people can get back to work. There's all those extra benefits that this is really highly important. You're right. We won't be able to just drop our guard immediately. That's true. But hopefully we'll get to that stage sometime in 2021 where, whether it's normal or at least less abnormal at this stage.
Yes, that should be the pitch for 2021. Less abnormal. Let's go for that.
Let's
But
go.
it will be, and the messaging will have to. I look forward to seeing like a best script out there, some best practices. Like how do you provide strong enthusiasm for vaccination while also making sure that you reinforce that patients need to stay safe, and stay safe in the public domain, in their family, and with their close contacts as well. But I do have one extra hypothesis that's my a huge ray of hope for me, and I don't know if this can happen, but COVID-19 has certainly captured the world's attention, like no other infectious disease in my memory. HIV would come to mind as well. But I'd say that this is a chance for, if these vaccines work, it's going to be really so much harder to be an anti-vaxxer and be vaccine resistant because they have the potential to save the world. And in so doing, if they are effective and if we move forward where we can deconstruct this pandemic systematically, gosh, that seems like there's just going to be a much greater credence by the general public into science and the scientific method, and I think that's something we can also use. So, if you want to think about things in a larger perspective, not that we always have time to in our practices, but every time you vaccinate somebody, you could be having an impact on where we go with regards to our future and believing in science and following its principles and its recommendations versus not. And that is a major factor, I think, a larger issue at play here.
Yeah, I really want to thank you, Chuck, for sharing those amazing closing thoughts. I think there's some of those corollary aspects that we'll learn more and more about. It's like the space program where
Right.
Teflon came out and so on. We're going to have a lot of extra issues there for sure. So I want to thank you again for sharing your time and expertise. I'll mention that we will have a second conversation which will focus a little more on strategies about people that are just vaccine hesitant regarding all vaccines and how we might work with that group to see if they might be amenable to immunization. So I want to thank everybody for listening.
Thank you. Stay well.
If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. Any questions or issues, feel free to email us at the address listed. To submit questions, please send them to qa@dkbmed.com. That's Q as in question, A as in answer, at dkbmed.com. Again, thanks for joining us and thank you for your dedication to your patients with COVID-19.